Hello everyone, this is Dr. Mandeep and I welcome back you all to the clinical case series by Nextillo. So the last time we were discussing a case and that case was a 48 female with nausea, vomiting, breast pain, breast enlargement and a white material could be expressed through her nipples. And we concluded that she had euvolemic hyponatremia secondary to SIADH, right? So she had euvolemic hyponatremia due to SIADH. Now, we also concluded that this was due to a prolactin adenoma. The question towards the end of the video was, what are the effects of high prolactin in patients who are male or female? Let's dive into that. So, prolactin is a hormone made by anterior pituitary by lactotrophs. So this prolactin has, rather high prolactin has two effects. These two effects are, the first one is inhibiting GnRH release and the second one is mammary gland development. So these two effects are inhibiting GnRH release and mammary gland development. So when GnRH release is inhibited from the hypothalamus, the FSH, which is follicle stimulating hormone, and LH, which is luteinizing hormone, they are decreased. As we know, FSH and LH, they have reproductive functions. When they decrease, so what they would cause? They would decrease libido in both men and women. So high prolactin causes decrease in libido because this is reproductive function. You would also expect in case of men there would be erectile dysfunction and oligozoospermia, right? So loss of libido or decreased libido, erectile dysfunction, oligozoospermia, all of these leading to infertility. This is in case of men. For women, we know that FSH and LH are important for normal ovulatory cycle, right? And that leads to menses. So if FSH and LH they decrease, what would happen? The menses, they may become less frequent or may become absent. So amenorrhea could be one feature of prolactin adenoma or high circulating levels of prolactin. In this case, our case, this patient is postmenopausal. So we wouldn't expect that, right? But the second thing that happens with high levels of prolactin is mammary gland development. So what would you see? Breast enlargement, the breast may become tender, and because mammary gland development is there, you could expect milk production. That is why this patient, our patient, had white discharge from her nipples. So she had breast enlargement and milk production. And this symptom set is called galactorrhea. And we have discussed both genders, that is male and females, and the effects of high prolactin in them. Let's dive into what are the mass effects of pituitary adenoma. For the mass effect, because pituitary adenoma is a tumor inside a closed cavity, the pressure inside the cavity with the growing mass would rise, and what it would do? It would cause headaches. And we know that as the anterior pituitary tumor grows, there is a relationship to the optic chiasm. The optic chiasm, when it gets compressed, there is vision changes. Especially because the optic chiasm is being compressed, it would lead to bitemporal hemianopia. Now, we have discussed the mass effect of this prolactin adenoma or pituitary adenoma. Let's move on to the follow-up question. The follow-up question for all of you is, this patient underwent MRI brain and they found out that there was an anterior pituitary mass of 1.8 centimeters. These guys had also sent for serum prolactin, and what would be the serum prolactin levels of this patient? This is where I end my discussion, and I want you guys to think over it. What could be the level of prolactin? And we would be back again with more discussion on this. And I believe this was a great learning experience for you. And goodbye. Take care.